venous arch, passes posterior to the lateral malleolus, accompanies sural nerve, ascend along the midline of the cuff, empty into the popliteal vein in the popliteal fossa. Short saphenous vein has a variable determination. It may be joined the great saphenous vein in the upper thigh or the thigh, either directly or through the accessory saphenous vein, may bifurcate and join great saphenous vein and the other of popliteal veins, and may end in the great saphenous vein in the leg or deep vein leg. Deep veins of the lower limb present within the deep fascia, under the deep fascia surrounded by the powerful muscles. Blood flow in greater pressure and volume account for 80 to 90% of venous return. Deep veins of the lower limb, femoral vein, popliteal vein, and the tibial veins, posterior-tibial veins, anterior-tibial vein, and the peroneal veins. Perforators, it communicates the superficial veins to the deep veins, have a role in varicose vein. All veins in lower limb have valves. Fairly constant in position, the valves, lateral ankle perforators, lateral ankle perforators, medial ankle perforators, posterior inferior to medial malleolus, 10 centimeter above the medial malleolus, 15 centimeter above the medial malleolus, gastrocnemius perforators of both around the knee, mid-thigh perforators, Dodds perforators, and Hunter's perforators in the thigh. Valves in great saphenous vein, 10 to 20 valves. One valve just before the great saphenous vein, piercing cribriform fascia. Valve at the saphenofemoral junction. In 80% of people, a valve is present in external iliac vein, which protects the saphenofemoral junction. Dorsal venous arch of the foot. It lies in the subcutaneous tissue over the head of the metatarsal, with convexity directed distally. It is formed by union of 4 dorsal metatarsal veins. Each dorsal metatarsal vein receives blood in the cleft from the dorsal digital veins and the proximal and the distal perforating veins, conveying blood from the plantar surface of the sole. Blood flow in the foot is directed from the deep veins to the superficial veins. In the leg and the thigh, it is directed from the superficial veins to the deep veins. The sympathetic nervous system increased venous return indirectly by augmentation of cardiac output through the Frank-Starling mechanism, relationship between the stroke volume and the diastolic volume. The law states that the stroke volume of the heart increase in the response to an increase in the volume of the blood in the ventricle before contraction, when all other factors remain constant. Factors are responsible for venous return from lower limb: inspiration as a respiratory pump, abdominal pump by negative pressure induced by diaphragm, cardiac pump by the cardiac suction effect, peripheral pump by skeletal muscle effect, venous valves that prevent venous hypertension and backflow of the venous blood. This is new terms and old terms of the anatomy. Greater or long saphenous vein is named greater saphenous vein. Smaller or short saphenous vein named small saphenous vein. Saphenofemoral junction is named the confluence of the superficial inguinal veins. Jagamin's vein in intersaphenous vein. Posterior arch vein of Leonardo vein. Posterior accessory great saphenous vein of the leg. Superficial femoral vein is a femoral vein. Cocket perforators, posterior tibial perforators. Boots perforator, paratibial perforators. Sherman perforators, paratibial perforators. 24 centimeter perforators, paratibial perforators. Hunter's and Dodds perforator is named perforators of the femoral canal. Mayos or Castro's perforators is named ankle perforators. Thank you. Anatomy is a gate for venous ulcer. Topics we are doing them. Thank you.
Thank you, Dr. Khaled.